Hi friends, in this lecture we are going to talk about histamine and the various antihistamine drugs. Let's start by looking at the properties of histamine. Histamine is a autocoid and it's found in high levels in your lungs and in your skin and also in other places in your body like gastrointestinal tract. And this so-called histamine is released from special types of cells called mast cells and basophils. And histamine is involved in causing type 1 hypersensitivity reactions. We have seen a number of drugs that can cause histamine release. Examples of those drugs are things like morphine and amphotericin B. And we have studied about vancomycin's histamine reaction, which is all about red man syndrome. And histamine works through a couple of G protein linked receptors. So most of the effects of histamine in the body are mediated by binding to histamine H1 receptors. So when you think about H1 activation, you get vasodilation through the formation of nitric oxide, right? So what happens here is activation of H1 receptors is being directly coupled to nitric oxide synthase, and this nitric oxide synthase, this enzyme is going to convert arginine to citrulline and releases nitric oxide, and this causes vasodilation, and this leads to increased capillary permeability and edema. H1 activation on smooth muscle cells causes smooth muscle contraction because H1 receptors on smooth muscle cells are GQ coupled. It's also the H1 receptor that's responsible for the pain and itching associated with histamine release. Whereas the H2 receptor is more limited in terms of where it's found. Mostly think about H2 receptors are present on parietal cells. When stimulating these receptors, you get an increase in gastric acid secretion that could lead to GI ulcers, making these receptors a special target for peptic ulcer medications. And in this video, we are going to specifically focus on the blockers of histamine H1 receptors. So all of these drugs are competitive antagonists. Certainly they are going to vary in terms of their pharmacologic and kinetic properties, and all these are summarized on the upcoming table. We divide the antihistamines into first generation and second generation drugs. In fact, I am going to take you to the second generation drugs present at the bottom of the table first, right? Then we move on to first generation drugs. See, the drugs like cetirizine, loratadine and fexofenadine are all second generation drugs, and you should start by learning the advantages of second generation drugs. The second generation drugs are less likely or very unlikely to enter your CNS, and as a result they are going to be much less sedating compared to first generation drugs. In fact, that is such a big advantage. I think it makes for an excellent test question. Whereas the second property of second generation drugs that will distinguish them from first generation drugs is that the second generation drugs don't block muscarinic receptors. See, all of the first generations have some anti-muscarinic effects that could result in things like constipation, dry mouth, or even tachycardia. So these drugs have two advantages. One is lack of CNS entry, making them to have less sedation effect, and the second one is these drugs don't have muscarinic blockage, right? Now when you look at the first generation drugs, the prototype is diphenhydramine, probably a drug that you know, probably even a drug that you have taken at some point in your life. Diphenhydramine can block muscarinic receptors. It certainly has the sedative effects and even has anti-motion sickness effects, indicating its ability to effectively get into the CNS. But when would be a time that you would want the sedating effect from this type of drug? Clearly, folks occasionally need help getting to sleep, so the sedating effect could be useful. We talked about second generation drugs not causing drowsiness, but at times you might actually want a drug to help you sleep. Promethazine, chlorpheniramine, and meclizine are other first generation antihistamines. In particular, note the anti-motion sickness effects of meclizine, so pretty effective antiemetic, as is promethazine, which is also commonly used for that purpose. When you review the uses for the histamine H1 blockers, I want you to think about whether or not it's first generation effect or second generation effect, or perhaps both. So when it comes to treating allergies, either first or second generation drugs can be useful. But if you are going to use one of these drugs for motion sickness, then it has to be only first generation but not second generation. Whereas for nausea and vomiting, it has to be a first generation drug. In fact, meclizine is useful for nausea and vomiting in pregnancy. Whereas in preoperative sedation, we need to use first generation drug followed by over the counter sleep aids. In this case, we need to get a first generation drug. But if it's an antihistamine found in a cold medication, either a first or second generation drug would be useful. In case of Parkinson's disease, we take advantage of the fact that first generation drugs block muscarinic receptors, which has some benefit in either Parkinson's disease or acute EPS. In both cases, we see increased levels of acetylcholine, and thereby blocking muscarinic receptors in this situation is so helpful with these first generation drugs. And there's not much to add to the side effects of H1 blockers that we have not already covered. And when we think about the sedative effects of the first generation drugs, again, that could be a benefit or that could be something that patients would complain of. Also, with muscarinic block, that's a property associated with the first generation drugs. So remember, a complaint of dry mouth would be associated with the first generation drug due to muscarinic block. This is the end of lecture, and this is all about the antihistamine drugs. Please subscribe to my channel for more interesting concepts. We meet in the next lecture with a new concept. Till then, stay tuned.